On this episode of Putting Possibility into Practice, we are unlocking new revenue potential. I'll be joined by Karen Hamer, Greenway Health Revenue Services Consultant, and Karen has harnessed her passion for helping physician practices remain independent to improve workflow efficiencies and result-driven billing processes. We'll hear from Karen on what practices can do to unlock new revenue potential on this episode of Putting Possibility into Practice, and it starts right now. And I'm Joe Augustinelli, Social Media Manager at Greenway Health. We are at MGMA 18, the annual conference in Boston, Massachusetts. And I am joined by Karen Hamer, Greenway Health Revenue Services Consultant, as we are unlocking new revenue potential and tips for providers to unlock new revenue potential for their practices. Karen, I thank you for taking time out of your busy day to join me on this episode of Putting Possibility into Practice.
Thank you for having me.
First, Karen, clinicians and administrators often rely on common key performance indexes to track their revenue. What KPIs should they be looking at to be most effective in their practice?
I would say to be most effective, looking at the net collections percentage as well as days in AR, and the average revenue per encounter will give them a picture of what's going on within their practice.
When we talk about days in AR, what would be average for a practice if maybe they're doing the billing on their own? What would be typical for a practice to see days in AR?
Sometimes we'll see it be a little elevated, about 40 to 42 days. The averages are between 30 and 35 for the specialties when they're being handled by a billing service, and that's what they're focusing on.
What are ways that these KPIs can be misleading and paint a falsely positive picture for a practice?
So net collections can be falsely positive with an increase in adjustment activity. An example of this would be if the AR is being cleaned up, then it falsely increases the net collections percentage, making it look like the practice is more successful than they are.
And when we say the AR is being cleaned up, what do we mean by that?
So any of the aging dollars that are sitting out there, the practice may be adjusting them off or writing it off. So when we do that, it makes the net collections percentage falsely high.
When you say depending on specialty, are there some specialties where days in ARs may be a little higher than other specialties, and what kind of specialties are we talking about?
So some of the surgical practices where they need to provide documentation to the payers prior to receiving the reimbursement will have a higher days in AR than somebody who just needs to submit a claim for an exam and receive reimbursement faster. So
let's say a practice wants to improve their billing performance. What is your advice to a provider out there who may be looking for ways to increase revenue and enhance their billing performance?
So a good way is to really understand the denials that are being received from the payers. It really gives you an idea as to where areas of improvement can be made on the front end of the revenue cycle. So if there's eligibility denials, look back at your eligibility and insurance verification process.
And when a provider, when there's a denial for a provider, are they given a reason for that?
Yes. So the payer will respond with a code that has also a narrative around it. What we find mostly, though, is that it's not being loaded into the system that the practitioners are using, so it can't be trended to help identify where efficiencies can be made.
So if they're not documenting that reason, there's really no way to tell exactly why there's so many denials coming in.
Correct, and it winds up being a more manual process and just working on it as they come in versus really fixing the problem where it's occurring.
And as I mentioned in the introduction, we are at MGMA 18, the annual conference in Boston, recording this episode. And one of the reasons that we're doing this episode here is partnering with MGMA for a webinar. And that webinar is coming up on Thursday, October 25th at 1 p.m. Eastern Time, Hidden Opportunities to Improve Your Patient's Revenue Cycle. And you want to talk a little bit about what you're presenting on that webinar?
Sure. So we're going through the key performance indicators that we discussed today, in addition to some others, and really helping to identify where those numbers are and if efficiencies are made, where they can be improved.
It'll be a 60-minute webinar, as I mentioned, on Thursday, October 25th at 1 p.m. Eastern Time. And some of the additional information for that webinar will have common revenue cycle KPIs that we discussed earlier on this podcast, and some warning signs that Karen had just went through, falsely positive metrics and ineffective workflows, and some methods and best practices that can be employed to improve billing performance. Now, to register for that webinar, you can go to www.greenwayhealth.com. The information will be on our website. You can also go to the MGMA website at www.mgma.com/events to register for our webinar, Hidden Opportunities to Improve Your Practice's Revenue Cycle. And once again, that'll be Thursday, October 25th from 1 p.m. until 2 p.m. Eastern Time. And Karen will be presenting that webinar. So I appreciate you taking the time to join me on our podcast, Putting Possibility into Practice.
Thank you very much.
And for more information on Greenway Revenue Services and for other products and services from Greenway Health, I invite you to visit our website at www.greenwayhealth.com. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thank you for listening to this episode. And a reminder, you can subscribe to our podcast on your platform of choice, now available on iTunes, Google Play, Stitcher, TuneIn, SoundCloud, and Spotify. Until next time, thanks for listening.